Bryan. For today, we have two different patients with two different problems, and I will apply the Rood'S approach using the different techniques of facilitation and inhibition.
Patient number 1, a 16-year-old girl
Who loves painting.
When she was a baby, she was diagnosed of having low muscle tone or hypotonia, and it is not yet treated until her 16 age years. She had experienced a decrease of muscle tone or a reduced range of flexibility
when sketching out the leaves. So since hypotonia is already detected by a pediatrician when she was a child, now my goal here is to use and apply to my patient the facilitatory techniques which can helping in normalizing tone and facilitating the movement of my patient. So the first technique is known as light moving touch.
All you need to have is your tips. But first, you need to identify a dermatome. Select a dermatome that will depend on which muscle you want to activate.
So the second technique is fast brushing.
Apply this brush in similar fashion over those dermatomes whose underlying muscles that you want to stimulate.
One important thing about this technique is when you use fast brushing, not only the muscle will activate, but it will also improve the sensory function of your patient. The third technique is known as icing or quick icing.
This time, we need some ice cubes and hold it using piece of cloth and apply it to the target muscle over the overlying skin for 3 quick swipes and immediately wipe the water using handkerchief.
The next technique is breathing facilitation.
Keep the ice cube over the desired dermatome with sufficient downward pressure for at least 3 minutes.
The fifth facilitatory technique is approximation. In this sequence, you must put our patient in the desired developmental pattern sequence.
This stimulates the joint's proprioceptors and helps improving the tones of stabilizing muscles of the joint.
The sixth technique is called stretch. There are 3 types of stretch. The first one is intrinsic stretch. So we use this technique since our patient's shoulder is lacking.
This is going to activate the proximal shoulder girdle muscles.
The second type of stretch is known as secondary ending stretch. All we need to do is ask her to do a movement. Then I will give the resistance to that movement.
We will just let it happen, then increase the resistance. And this way, we are allowing the muscles to contract.
The third technique in stretch is known as stretch pressure. For this technique, we will utilize our index finger, middle finger, and thumb.
First, we need to palpitate the tendon of the muscle which we need to activate. This is going to activate the muscle's tendon.
So the final technique for this session is known as proprioceptive facilitatory technique. So now, we will apply the resistance properly to improve the muscle strength of my patient and to motivate her to work harder.
When we start resisting a contraction of weak muscle, then the muscle goes into shortening. From the spasm of the muscle also shortens. Relatively, and surely, it will lead to a better facilitation of that muscle.
Under the proprioceptive facilitation is tapping.
In this technique, we will just be using our hand and apply 3 to 5 quick repetitions of tapping over the dermatome overlining the muscle between 1 to activate.
The third way of giving proprioceptive facilitation is by giving vestibular stimulation. And that concludes the different facilitation technique for my patient who has hypotonia.
Patient number 2, 8-year-old girl who has spasticity. It is the condition in which muscle stiffen or tighten, preventing normal fluid.
So our problem here is the muscle of my patient where it remains contracted and there resists being stretched that affects her movement speech. So our goal here is to reduce spasticity. So we will apply the inhibitory techniques or inhibition that suited in her case. The first technique is known as rolling.
Rolling is slowly from as a timeline position to proning back in rhythmical pattern to promote relaxation.
The second technique is known as slow stroking.
Generally, calming effect can decrease muscle tone. This is used to produce a generalized calming effect by hands activation.
The third technique is known as tendon pressure.
Fear pressure manually over a muscle tendon to reduce spasticity.
The fourth technique is gentle shaking.
We used slight joint compression contraction of the cervical vertebrae, slow rhythmic circumduction of the head to promote relaxation.
And the last technique is called rocking.
Rhythmical circumduction of the pelvis and slight approximation is given to promote relaxation and reduce spasticity.
And that concludes the different inhibitory techniques for my patient who has spasticity.